my name is Lisa, and I was diagnosed with non-Hodgkin's lymphoma, diffuse B cell. My first diagnosis was in May of 2015, and then again in August of 2019.
Hi, I'm Dana. I was diagnosed with stage 4 diffuse large B cell non-Hodgkin's lymphoma, January 2018.
You need to feel comfortable with that doctor. It's a relationship, and it's a relationship unlike any other doctor you have. Your oncologist has to be more personal to you than your primary care physician, and you need to be able to speak to them about your fears and insecurities, and also all of the other things that go along with cancer. It's not just the diagnosis, it's not just the treatment, it's the mind, body, and soul that comes with it. And so having a doctor that can be compassionate and understand that, you know what, I'm crying, and it's not because I feel terrible, it's because my brain is still in the fight, even though my scans are clear. And understanding that emotional aspect of it without minimizing it. And that's huge. And if you find that, it's definitely a very good match. And somebody who's going to be sensitive to your spouse's needs and your children's, and understand that you're more than just a cancer patient. You're a mother, you're a wife, you're a sister, and all of that encompassing. And I've been so blessed and fortunate to have that in my oncologist.
Depending on how aggressive your disease is, you have to be very direct with the doctor. And even if you feel like you're coming off as scared and emotional and fearful, I say let it all out in the office with the doctor. They've seen it all. And because I was always in a desperate situation when the cancer came back, because it would always be stage 4, especially the very beginning, I just say whatever came out of my mouth, and I didn't care. And I think that's how you have to be when it's a life and death situation. And some patients want to know everything about their disease and what the doctors are doing. And some patients don't. And there's no judgment if you only want to know a little bit of information at a time, or you want to dive deep in the internet and have the doctor explain everything to you and make them take their time. I happen to be a patient that doesn't need to know every little detail. I trusted my team because I was always in a desperate condition to do whatever it took to try to keep me alive. And it's not my nature to go deep into the internet. I'm not that fascinated about every single medical procedure. And you decide the kinds of care from the people around you that you want. And if you feel like somebody's saying something to you that doesn't resonate, you can politely say, that doesn't work for me, or that's making me very stressful. Because people are really well-meaning, but they end up saying things that make them feel good and not necessarily make you feel good. You can find a way to politely say, again, that doesn't work for me, or, please just thank you, but I'm going to do it this way. And I think those will be helpful. It's not easy, but if you can get to the other side, it's a richer, truly more meaningful existence. And I applaud you all for your courage.
Also be very open about your fight, and know that it's okay to tell people, I'm too tired, I'm not going to do it.
I think a caregiver should try to keep things really simple and remain calm. Again, keep things simple. Don't try to bombard that person with too many questions. Just try to pare things down, because people that are sick are very overwhelmed and they can only take in so much. The bandwidth becomes, I think, very narrow. And try not to act shocked about certain things that are going on. Just try to be calm.
Scanxiety is very real. The feeling of always having that anxious feeling, it's perfectly normal. People will always say, oh, your scans were cleared, why are you nervous? You should be fine, or why aren't you rejoicing in it? And there's nothing wrong with being scared. It's our reality, and people tend to minimize that, and understanding that, you know what, just because people around you are minimizing it doesn't mean that other people don't feel it. And most of us who've been in the struggle and been in the fight know exactly what you're going through. That's what I would say to my peers, to the caregivers: support them. Support them, because just because they're not sick anymore doesn't mean that there's not emotional scars that need healing. And doctors and and physicians, we're more than just the chemo side of the treatment. There's also the emotional and the mental aspect of it that will need treatment far after the remission has set in.
It's very difficult and scary. And I don't know if patients, when they're diagnosed, are shocked because there's no history of cancer in their family, or they felt they lived healthy lives and they figured that cancer wouldn't reach them. It's for all the other slobs out there that do all the wrong things or have bad genetics. And I had kind of an elitist attitude. I thought, well, there's not much cancer in my family. I'm pretty healthy. I'm not crazy healthy, but I was busy and happy and running around. And I got hit really hard. And there's no discrimination with patients getting diagnosed with lymphoma. There's no hereditary component. It has nothing to do with what you ate or what you drank or what you did in college. It just happens. And I think you have to find a way to accept it, fight it when it's worth fighting, and take down your fists when it's time to hunker down and get through it. And there's always hope. There's always hope.
My biggest piece of advice to anybody who's either relapsed or has refractory diffuse large B-cell lymphoma is to try not to lose hope. And it's okay to cry. It's okay to be angry. It's okay to go through all of those emotions. But to look to people or to resources that you can actually dialogue with, as opposed to just things that you can read. Because when you just read about it, you always end up picking up all the bad things. If you find a source of somebody that you can actually talk with, whether it be a support group, a Facebook group, or something, they're going to give you more options. You'll be able to hear more stories, and that'll be uplifting. So that's my biggest advice.